Hello there, what's good? I hope you're well. I'm super. Thank you very much for asking. So today I'm at work and just felt like I should take a few moments and share with you something about drugs that are affecting central nervous system. So earlier in our previous video we did acetaminophen as one of the drugs that are affecting the central nervous system. So today I want to take you to non-steroidal anti-inflammatory drugs. This is one example, classic example that affects the central nervous system. So sit back, relax, and before we proceed, please consider subscribing, commenting, and sharing this video. Give me a stamp. Welcome again. So NSAIDs, non-steroidal anti-inflammatory drugs. These are members of a class, members of a therapeutic drug class that reduces pain, it decreases inflammation, decreases fever, and prevents blood clots. So that is just the meaning, the classical meaning of an NSAIDs. Classifications, they are classified in terms in different classes. So one classical example is salicylates. So salicylates, this is where we have got aspirin, commonly known as acetylsalicylic acid. Then we have got another class called the diflunisal, that is dolobid, salicylic acid and its salts. And then we have got sulfates. So that is those are classes. Another classical example is another classification is propionic acid derivatives, where we have got brufen, ibuprofen, deoxyprofen, naproxen, phenoprofen, ketoprofen, dexketoprofen, flubiprofen, and we have oxaprofen, levofloxaprofen, zaltoprofen. So those are propionic acid derivatives classification. Another classification is acetic acid derivatives, where we have indomethacin, commonly known as Indoseed in the market, then tolmetin, sulindac, etodolac, ketorolac, and diclofenac. Okay, acetic acid derivatives. So etodolac, ketorolac, diclofenac, aceclofenac, bromfenac, nubiprofen. And then we have got enolic acid derivatives. Commonly we have got piroxicam, meloxicam. Those are the common ones basically in the Kenyan market. Then you have tenoxicam, droxicam. So then another classification is the anthralic acid derivatives. Okay, they are derived from the phenamic acid, which is a derivative of the anthralic acid. So examples, we have got the mefenamic acid, meclofenamic acid, flufenamic acid, and tolfenamic acid. Again, another classification is the selective COX-2 inhibitors. So the COSIBs, where we have got, but mostly this class has been it has not been approved. Most of them have been withdrawn from the market because of their effects. So we have got selecosib, rofecosib, valdecosib, lumiracosib, etericosib, firoxicosib. Yes, that is it. And then we have got sulfonamides. So sulfonamides, just one, nimesulide. So that is a classical example. Most of these NSAIDs, they are molecules that are chiral in nature, that is racemic mixtures, meaning they have equal amount of potency in both salts. Both of their salts have equal amounts of potency. So that is basically chirality. Molecules such as diclofenac is a notable exception, but most of these molecules exist in chirality, racemic mixtures, just to mean whatever we just said behind them. Now, medical uses of NSAIDs. So medical uses of NSAIDs has they are suggested and often suggested in treatment for the treatment of chronic or acute conditions where pain and inflammation are present. So they are often suggested in such scenarios. So generally they are used for symptomatic relief of osteoarthritis, rheumatoid arthritis, mild to moderate pain, in tissue inflammation and tissue injury. Yes, excuse me. Okay, they are also indicated in low back pain, inflammatory arthropathies. That is where we have arthropathies. These are where we have ankylosing spondylitis, psoriatic arthritis, and reactive arthritis. So tennis elbow, migraine, headache, acute gout, dysmenorrhea, menstrual pain, basically dysmenorrhea, metastatic bone pain, postoperative pain, muscle stiffness, and pain due to Parkinson's disease. And we have got renal colic, muscle stiffness, pyrexia, ileus. So ileus is the disruption of the normal propulsive ability of the intestine. So that is ileus. And then we have got macular edema. Fluid and protein deposits collect under the macula of the eye and causes it to thicken and swell. Thickening and swelling, that's just edema. Then traumatic injury. So basically those are the major areas where they are indicated in those chronic pains. So others include chronic pain and cancer related pain and inflammation, surgical pain, dentistry, that is post-operative dental pain following invasive of dental procedures. So that is basically some of the medical uses of NSAIDs. Classical examples, those are known in the market: diclofenac, brufen, meloxicam, the ones that we've just mentioned earlier. So contraindications. This class of drugs that act on the CNS are contraindicated in these conditions. They are used with caution by people with the irritable bowel syndrome, that is IBS, and persons who are over age of 50 and who have family history genetics of GE problems, then persons with previous GE problems from NSAID use. Peptic, they are avoided in people with the peptic ulcer disease or stomach bleeding, uncontrolled hypertension, kidney disease, people with the inflammatory bowel disease. That's different from the IBS. This is now IBD, Crohn's disease or ulcerative colitis, past transient ischemic attack. Sorry for the name. Let's come back, and please, before we continue, hit that subscribe button, like, share, and comment, so that we grade, we see whatever information we are giving. So welcome back. Now we were on contraindications, and kidney disease was one of the contraindications. You avoid it when you have a kidney disease. And then we have got ulcerative colitis, that is inflammation of the inflammatory bowel disease, past stroke, history of having a stroke, past myocardial infarction. Those are heart diseases. Coronary artery disease. Coronary artery disease. When you are undergoing coronary artery bypass in third trimester of pregnancy. So third trimester of pregnancy, when you are pregnant, the last phase of it, avoid it. Persons who have undergone gastric bypass surgery, persons who have got history of allergic like NSAID hypersensitivity reactions, especially aspirin, exacerbated respiratory diseases. So basically that is the contraindications part. Now let's move into adverse drug reactions. These are the secondary intended, they are called the unintended reactions, effects of a drug. So widespread use of NSAIDs, they increase risk of GE, gastrointestinal problems, kidney diseases, and adverse cardiovascular events, just like we said on the contraindications. So other effects are possible erectile dysfunction or dysfunction risk. So that is on overtime use, and then photosensitivity, that is sun poisoning of some molecules or drugs that when you taken, they expose our bodies. Then allergy and allergic like hypersensitivity reactions, possible effects on the bone and tissue injury. Ototoxicity, somebody hearing loss, you might lose your sense of hearing. Now, drug interactions. This is how the drug interacts with other drugs. So NSAIDs reduce kidney blood flow and reduces the efficacy or effectiveness of the diuretics because it interferes with the kidney. So it aggravates hypertension, and then it reduces the effectiveness of antidepressants. It may also reduce the effectiveness of antibiotics, the quinolones. So immune response. So immune response is how body responds to different diseases. Now, small doses of NSAIDs generally, they have a little or no effect on our immune system, and large doses significantly suppresses it poses a lot of suppresses the production of immune cells. So meaning long-term use will always predispose us to low immune system, because actually the immune system, the immune cells, they are produced very slow. Their rate of production is usually very low, so it will interfere with our response to different diseases when we are stricken. And now let's go back now to pharmacology bit of it, when now we are talking about pharmacodynamics and pharmacokinetics. So pharmacodynamics, yes. Now, mode of action, or majorly the mechanism of action of the NSAIDs. This is basically most NSAIDs act as non-selective inhibitors of the COX, that is the COX, cyclooxygenase enzymes, inhibiting both the cyclooxygenase 1 and the cyclooxygenase 2 enzymes. So this inhibition, that is the mode of action. This inhibition is completely actually irreversible. I mean, it is completely reversible, would mean that the enzymes binds to the proteins. Irreversibly, it can always remove, detach or attach itself, as opposed to mechanism as aspirin. Only aspirin ndio iko na hiyo irreversible inhibition. Okay, so then COX, to just refer between both. This inhibition is completely reversible as opposed to that of aspirin. So COX, the cyclooxygenase enzyme, catalyzes the formation of prostaglandins and thromboxane. Those are two proteins that are there from arachidonic acid. So prostaglandin acts as messenger molecules in the process of inflammation. So basically that's it. Wow, that was so intense. Now kindly guys consider subscribing to this channel so that you can get more information on medical aspects. So just to conclude on the pharmacodynamics of these NSAIDs, because they are classes, we've just given those examples and there's so many. So the other part is the antipyretic activity. That's still on the mode of action. So NSAIDs have an antipyretic activity and can be used to treat fever. So fever is caused by elevated levels of prostaglandin E2, that is very specific, which alters the firing rate of neurons within the hypothalamus that control the thermoregulation. That is now where we use this anti-inflammatory drugs to regulate our fever, though not that effective. So that done, we are getting to pharmacokinetics. So pharmacokinetics, now this is now the last part where now NSAIDs are absorbed well from the stomach and the intestine, the intestinal mucosa. Then they are highly protein bound in the plasma, increasing to that 95% attachment. So basically they attach to the albumin protein, and their bioavailability approximates to plasma volumes. So basically it's very available because of the plasma volume. NSAIDs are then metabolized in the liver by oxidation and conjugation, and the metabolite and to inactive metabolites, which is excreted through urine. The major excretion route is urine, though some of the drugs can be excreted through the bile, partially excreted through the bile. So a classical example, I'm having one here, very common, Brufen. Let me see. Okay, Brufen. This is one of the classical examples of non-steroidal anti-inflammatory drug, commonly used. I have it here. Basically found in clinics, hospitals, typically in the village, like the setting that I'm in. So Brufen and diclofenac have got short half-lives, basically 2 to 3 hours. When you take it at 2 to 3 hours, done. You've achieved your result, killing the pain and the inflammation. But piroxicam, the oxycams, which class were they? The oxycams, okay, those are the onolic acid derivatives. So they have a very long half-life. So basically that's it. Now examples, Brufen, the one that I've shown you, is taken by mouth, and they are found in form of tablets, capsules, suspensions, and intravenous IV. Though I've never come across Brufen IV, but it's there. The information has it that it's there. So thank you for watching this video. Let's interact more. Meet in our next video. Subscribe, share, and like. Bye.